nerve supply of any internal organ. Maybe gland. Yes, for example, here it is nerve supply of parotid gland. And you will have to describe not only parasympathetic, not only sympathetic, but every type of nerve supply, because now we kind of completed, yes? So here you can see, for example, this parasympathetic supply, what we discussed today, that parasympathetic supply of parotid gland passes from inferior salivatory nucleus. Yes, so from inferior salivatory nucleus, preganglionic fibers first start, and they move first in the main trunk, glossopharyngeal nerve, then tympanic nerve, or this Jacobson's nerve, yes, then it was tympanic plexus. From tympanic plexus, lesser petrosal nerve starts, which exits like first through hiatus for lesser petrosal nerve, then oval foramen, so comes up to otiganglion, and so all of this are still preganglionic fibers. I will later say that preganglionic fibers in parasympathetic nervous system are longer than in sympathetic. And postganglionic fibers, they are very short. They just arise from otiganglion, join auriculotemporal nerve, and come up to the parotid gland. Sympathetic fibers, they usually follow together with arteries. So first, you know that central part of sympathetic nervous system is present in sympathetic nuclei of lateral horns from C8 to L3. And so for parotid gland it is C8 to TH1, maybe 2, you will check it. And then these preganglionic fibers, they are very short, because the superior cervical ganglion, it is a ganglion of sympathetic trunk or sympathetic chain. And sympathetic trunk is located laterally from vertebral column, so very small distance. So here in sympathetic nervous system, preganglionic fibers are very short. And then all of this, these are postganglionic fibers. So from superior cervical ganglion, first common carotid plexus, then external carotid, along the arteries, yes? Then maxillary plexus around the maxillary artery, then middle meningeal plexus around the middle meningeal artery, and from middle meningeal plexus, also sympathetic fibers move to the parotid gland. And so sensory fibers, we also discussed that it goes from sensory nuclei of trigeminal nerve, so not mesencephalic, because proprioception is not needed here, yes, so pontine and spinal nucleus, then the main trunk, trigeminal nerve, trigeminal ganglion that contains bodies of sensory neurons, yes, then mandibular nerve gives auriculotemporal, and from auriculotemporal it goes to the parotid gland. So like that, you will, at the beginning of the next lesson, describe nerve supply of any internal organ. It can be gland, it can be any other organ, it doesn't matter. Okay, and what else will you do? You will read everything about sympathetic and parasympathetic nervous system. So for parasympathetic, we actually have already discussed a lot, because both sympathetic and parasympathetic nervous system have central part and peripheral part. Yes. So central part of parasympathetic nervous system has cranial part that is presented by parasympathetic nuclei of cranial nerves, and this we discussed, but you will revise again. And also sacral part that is present in sacral segments of spinal cord from S2 to S4. This you will also read. Central part of sympathetic nervous system is located in lateral horns. Yes, which segments of spinal cord have lateral horns?
C8 to L3.
Yes, from C8 to L3. So there are sympathetic nuclei, and it is central part of sympathetic nervous system. Peripheral part of sympathetic nervous system is presented by sympathetic chain or sympathetic trunk, and then the other ganglia, and then fibers, plexuses, and so on. All of these plexuses you will also study for the next lesson. The largest autonomic plexus, it is celiac plexus. Actually, if you know arteries,
Celiac plexus is a branch of vagus nerve.
not only,
Okay.
it is like mixed. Yes, parasympathetic fibers come from vagus nerve, but sympathetic fibers come from sympathetic trunk, from this greater and lesser splenic nerve. Actually, if you know arteries, then this plexus is not, they will not be difficult for you, because celiac plexus everywhere surround branches of celiac trunk. Yes, first celiac plexus, then left gastric, common hepatic, this splenic. So if you know arteries, it's not difficult. So celiac plexus you should study. Superior mesenteric plexus, no, all the largest plexus is autonomic plexuses. Superior mesenteric plexus, inferior mesenteric plexus. What? Superior and inferior hypogastric plexuses. This you will study. Formation and all the branches, please. You should study. And it is not against the end. Also, at the beginning of the next lesson, each of you will draw somatic or autonomic reflex arch. So you have to know the difference. We have also discussed it, but now we'll talk about it again. Okay. So what is the least amount of neurons that can be present in somatic reflex arch? Two, yes. They are only two. One sensory and one motor. Yes, it is the least. In the simplest reflex arch, there is one sensory neuron and its body is in the dorsal root ganglion. Yes. The axon enters through posterolateral sulcus, then reaches anterior horn, it forms synapse. So it is first order neuron, it is second order neuron, and then it goes to the working organ. So this is the simplest somatic reflex arch.
Two neurons.
Yes.
Two neurons.
Yes. This we understand. Yes, simplest contains two neurons. So for autonomic reflex arch, there are always two motor neurons. It is compulsory. And they are different neurons. They are not like this motor neurons, like here. These neurons, we can say they are somatomotor. Somatomotor. Soma means body, yes? Somatomotor neurons, because they finally supply skeletal muscles. These motor neurons, they form autonomic nuclei in the CNS. And outside of CNS, they form autonomic ganglia, yes? Because they are visceral motor, yes? Visceral motor. We cannot, we cannot regulate their work.
For smooth muscles. For smooth muscles.
Yes, for smooth muscles and for glands. And they always two motor neurons. So again, there is sensory neuron. Its body is located outside of CNS. Yes. Then its axon again enters through posterolateral sulcus, and here it forms synapse inside the lateral horn. It is for sympathetic reflex arch. Yes. And here it is second order neuron or first visceral motor neuron of autonomic reflex arch. And then it goes together with motor fibers, yes, through anterolateral sulcus. And we were saying that it goes together, forms trunk, and then it forms white communicating branch, because it is formed by preganglionic fibers, yes, before the ganglion. And these preganglionic fibers, they are covered by myelin sheath. Yes, so they are myelinated, that's why they are white. And so here it is what?
Autonomic ganglion.
Ganglion, yes, autonomic ganglion. Third order neuron of autonomic reflex arch, or second visceral motor neuron. And from here, postganglionic fibers start. They are non-myelinated, they are gray because they are not covered by myelin sheath. Postganglionic, yes, or gray communicating, we can say. Okay, postganglionic. And they reach working organ, that is smooth muscle or gland. So that is the main difference between somatic and autonomic reflex arch, that in somatic there is at least two neurons, but in autonomic there are at least three always.
Ma'am,
yes.
In which segment does not have lateral horn,
yes,
but gray communicating branch connects with upper above
yes,
and lower.
Yes, it is possible also. And also it is for sympathetic now we draw. When we draw for parasympathetic, there is no lateral horn. There is just intermediate substance at the segments of S2 to S4, for example, just intermediate substance, but still there are this, yes, parasympathetic nucleus. Okay, what else did I have to say? This you will draw, maybe somatic, maybe autonomic. You have to know the difference between sympathetic and parasympathetic also reflex arches. Functionally, you had to study it at school. Yes, at parasympathetic it is like rest and digest. Yes, in a calm condition it works, and sympathetic in a condition of stress. But anatomically there is also difference. I told you that this ganglia for sympathetic, they are located very close to vertebral column. So it means that preganglionic fibers are much shorter in sympathetic nervous system than postganglionic. And all of this parasympathetic ganglia, which we have already discussed, ciliary ganglion, foveoculomotor nerve, yes, this sublingual, submandibular, pterygopalatine, otic ganglia, all of these ganglia are located near the organs, which fibers which start from its supply. So that's why for parasympathetic nervous system, it is vice versa. Preganglionic fibers are very long and postganglionic fibers are short. One more difference is in the preganglionic, again I think I'm confusing. Yes, I think one more difference, it is in postganglionic neurotransmitter. For preganglionic neurotransmitter, so this substance, chemical substance, which transmits impulse here in this sinus between preganglionic fibers and ganglion, it is always acetylcholine, yes, acetylcholine. But here in postganglionic, in parasympathetic, it is again acetylcholine, but in sympathetic it will be norepinephrine, yes, or noradrenaline. So this is also the difference. So you have to know for the next lesson the main differences between sympathetic and parasympathetic nervous system. Yes, no, you should revise the parasympathetic parts of cranial nerves and study sympathetic tract also, and all these main plexuses. So that's what you have to study. And of course you have to revise cranial nerves because you have to also describe sensory supply of organs. That's it. Any questions?